Thanks. For the latest on efforts in the U.S. To stall the spread of the coronavirus, let's welcome Dr. Mark Mulligan, director of NYU Langone Health Vaccine Center and their Infectious Diseases and Immunology Division. Doctor, thanks for joining us. Can I focus on the prospects for widespread testing and whether you think that imminently we're going to be in a much better position to accurately decide how much of the virus is actually in the United States?
Yeah, diagnostics are such an important part of the response to an epidemic, and we have to know who's infected in order to properly isolate them and trace their contacts. I do think we're going to see a major uptick. The FDA did a wonderful thing on this past Saturday when they made it more rapid for local hospitals to bring their own tests into use. And we have more and more state and local health authorities like the city of New York, the state of New York, now doing testing. So the answer is yes. I don't know how quickly, but we're clearly seeing a ramp up, and that is a great thing.
What did the FDA change? Was it prohibited for local hospitals to use their own tests?
What they did was to create a streamlined pathway for validation of tests by laboratories that had developed their own tests, so that they can actually, once they validate, do the initial...
They weren't allowed to do that before. I saw President Trump. Right. I saw that President Trump pointed a finger at the Obama administration for not having that rule. Is that the rule that you're talking about?
No, what I'm talking about is during an epidemic, we get special authorizations and guidances to respond. They're not needed all the time. And in response to this, it was needed, and they did it, and that's great.
Okay, so we haven't had enough testing so far.
Correct.
There's two schools of thought. One is that it's the tip of the iceberg that we know about because we haven't been testing. The other is that you don't see the anecdotal evidence of emergency rooms being flooded with symptomatic people that appear to have the coronavirus. Would we know if it was much more widespread than we think by seeing people come to the emergency room right now?
We might. It's a little tricky because we're in flu season. Flu is waning. Our positive flu test, the percentage of all the tests that are positive on people coming in with respiratory infections is lower. Okay. That actually might be our signal, that we're still seeing a lot of people presenting with respiratory illness, but it's not so high flu anymore at this point. Flu goes down in the spring. So that could be it. And I do, to answer your question, I do think that the detected cases thus far are the tip of the iceberg. I think there is more circulation going on. We have some scientific evidence to support that in Washington State based on viral sequences.
Okay, so then the next question is the way that China reportedly handled it, which it looks like they've gotten a handle on it to some degree. At least that's what they're telling us.
Right.
Is that a nature of the virus itself, that it is something we can deal with, or is it the draconian things that China is able to do because it's a communist state and we can't do that here?
Yeah, I think that we can deal with it, we can mitigate it, we can do our very best to control it. There are very common sense public health measures that we can do. Isolation of cases, quarantine of contacts, all doing our social distancing. We will need to do phases or versions of what they did there, I think, in terms of limiting social contact during this very unique, unprecedented time that we're facing. Of course, we're not going to do the most extreme things that they did, but many of the things that they do in terms of limiting travel and contact with others are things that are effective.
Dr. Mulligan, how able is our medical system able to handle this, based on the number of cases that might be coming through? I've heard from some hospitals that they're already pretty full, just without the coronavirus.
That's right, and that's how it is every year during respiratory virus season. During flu season, we tend to fill up our hospitals, our ICUs. Older people, people with respiratory illnesses are in the hospital. So I think our hospitals have capacity to absorb a large number of cases, but it is also possible that we will exceed their routine capacity. In that case, most hospital systems have made extenuation plans where they can make new wards or areas for handling patients. And then the worst case scenario was we even exceed our second level expansion capacity.
What about staffing in those situations? Because we know we have shortages of ventilators and of masks and things along those lines. But I also know from some people who work in hospitals that they'll say 20% of the people call out if there's a snowstorm. What do you do if people get worried about coming into work because of the coronavirus?
Right. Well, I think that we might have shortages because of exposures and people have to go into quarantine. You know, that maybe workers who are coming to work get exposed on the way to work. Some case it was on the subway, something like that. I think it would be a shame for healthcare workers not to show up for work because they wanted to avoid the situation. I think they have to believe that the personal protective equipment and the measures, the operating procedures we have in place work. We know that personal protective equipment can be highly effective. The things that the doctors, nurses who will be taking care of patients will wear, those work.
Are you in a position to give an opinion on what the actual mortality rate is?
Yes.
What do you think it is?
Yeah.
Do you think it's as high as the WHO said?
Which figure? Because the figures are changing all the time.
Well, which one?
Said 4.3%, but that was worldwide.
4.3 seems high. 4.3.
4.3. Yes.
What do you think it really is?
My opinion is that the estimates, right, that the denominator is much higher and that the percentage will be lower. We actually know from some of the reporting that the mortality rate in Wuhan itself was over 3%, but that everywhere else in the globe was closer to 1%.
Why?
My feeling, well, because the reporting and the cases that were appearing there were the severe illnesses, all the people that are doing well. Remember, for 80% of us, if we get this, younger, healthy people, we're going to do just fine. Children seem to do extremely well with this.
Right.
There have been no deaths reported in children under 10. So I think that we have to keep this in some perspective. Let's remember that 19,000 people have died of flu this year already. We've had 29 million flu infections.
Right. We didn't rush any of those tests on the air. So that is a difference. But we try to do what we can, Doctor, considering both sides. Dr. Mulligan, thank you.